Welcome back to our channel. Today, we're diving into a crucial health topic that could change your life. We're talking about prediabetes, a condition where your blood sugar levels are higher than normal, but not high enough to be diagnosed with type 2 diabetes. The good news? It can still be reversed. We're going to uncover 14 silent signs of prediabetes that you should never ignore. So, are you ready to take control of your health? Let's break down these signs and empower you to make informed decisions about your well-being. Let's start with a common yet often overlooked sign: frequent urination, especially at night. When your blood sugar is high, like in prediabetes, your body tries to flush out the excess sugar through your urine. This means more trips to the bathroom, disrupting your sleep, and leaving you feeling tired. Now, occasional changes in urination can be normal, but if you're constantly finding yourself running to the bathroom, especially at night, it's a red flag to pay attention to. Keep in mind that other factors can contribute to frequent urination, such as certain medications or urinary tract infections. That's why it's crucial to see a doctor if you notice this symptom, along with any others we discussed today. Now let's move on to the next sign. Increased thirst often accompanies frequent urination. Losing fluids more often makes you feel thirstier. It's your body's way of telling you to replenish lost fluids. Constant thirst, even without activity, could signal an issue. Combined with other signs, it's worth consulting a doctor. Let's explore more silent signs of prediabetes. Unexplained weight loss can be a red flag for prediabetes. When your body can't use glucose efficiently, it breaks down muscle and fat for fuel. This leads to unexpected weight loss, even without changes to diet or exercise. If you're losing weight without explanation, consult your doctor to rule out prediabetes. Always seek medical advice to understand sudden weight loss. Let's move on to the next sign, common in our busy lives. Chapter 4. Fatigue. Feeling tired all the time? You're not alone. Fatigue is a common symptom of many health issues, including prediabetes. When your cells aren't getting the glucose they need for energy due to insulin resistance, it can leave you feeling drained and sluggish. This fatigue can manifest as difficulty concentrating, decreased motivation, and an overall lack of energy, even after a good night's sleep. Now, we all experience fatigue from time to time, especially in our fast-paced world. But if you're constantly feeling exhausted and it's impacting your daily life, it's important to take notice. Let's move on to the next sign, which involves one of our most important senses. Chapter 5. Blurred vision. Blurred vision is another sign you shouldn't ignore. High blood sugar can damage the tiny blood vessels in your eyes, leading to a condition called diabetic retinopathy. This damage can affect your vision, causing blurriness, floaters, or even vision loss if left untreated. Now, blurred vision can be temporary and harmless, like when you wake up in the morning or spend too much time staring at a screen. But if it persists, comes on suddenly, or is accompanied by other symptoms, it's crucial to seek immediate medical attention. Let's move on to a sign that's related to your body's ability to heal. Chapter 6. Slow healing sores. Have you noticed that cuts, scrapes, or sores seem to take longer to heal than usual? This could be another sign of prediabetes. High blood sugar can impair circulation and weaken your body's natural healing process. This means even minor wounds can linger, increasing the risk of infection. If you notice any significant delays in wound healing or experience frequent infections, it's essential to bring it up with your healthcare provider. Slow healing sores can be a sign that something is interfering with these natural processes. Let's move on to another sign that's related to your immune system. Chapter 7. Frequent infections. High blood sugar, even in the prediabetes range, can weaken your immune system, making you more susceptible to infections. This is because sugar provides an ideal environment for bacteria and fungi to thrive. If you're experiencing frequent or recurring infections, like urinary tract infections, yeast infections, or skin infections, it's essential to consider prediabetes as a potential contributor. When our blood sugar levels are elevated, it compromises our immune defenses, making us more vulnerable to infections. If you find yourself battling infections more often than usual, don't hesitate to talk to your doctor. Now let's move on to a sign that you might notice on your skin. Chapter 8. Darkened skin areas. Have you noticed any patches of darkened skin, particularly around your neck, armpits, or groin? This condition, known as acanthosis nigricans, can be a sign of insulin resistance, a key feature of prediabetes. These patches of skin may feel velvety or rough to the touch. While acanthosis nigricans can be associated with other medical conditions, it's often a visible clue that your body is struggling to use insulin effectively. If you notice any unusual skin changes, especially darkening or thickening of the skin, it's essential to consult with a dermatologist or your primary care physician. Let's move on to another sign that involves your extremities. Chapter 9. Tingling or numbness in hands or feet. Tingling, numbness, or pain in your hands or feet, a condition known as neuropathy, can be another sign of nerve damage caused by high blood sugar. This tingling sensation can range from mild pins and needles to more intense pain or burning. Over time, high blood sugar can damage the delicate nerves in your extremities, leading to these uncomfortable and sometimes debilitating symptoms. Neuropathy is a common complication of diabetes, but it can also occur in the prediabetes stage. If you're experiencing any unusual sensations in your hands or feet, don't dismiss them. Let's continue exploring other signs that could indicate prediabetes. Chapter 10. Increased hunger. Are you constantly feeling hungry even after eating a satisfying meal? This insatiable hunger, also known as polyphagia, can be a sign of prediabetes. When your cells aren't getting enough glucose for energy due to insulin resistance, your body goes into starvation mode, triggering intense cravings and increased appetite. While it's normal to feel hungry at certain times, persistent, uncontrollable hunger can be a red flag. If you're constantly reaching for snacks, experiencing sudden spikes in appetite, or feeling unsatisfied after meals, it's essential to pay attention to this sign. Let's move on to a sign that affects our emotional well-being. Chapter 11. Irritability and mood swings. Experiencing more mood swings or irritability than usual. Fluctuations in blood sugar levels can wreak havoc on your mood, leading to feelings of frustration, anxiety, or even depression. When your blood sugar is high, it can cause a surge of energy followed by a crash, leaving you feeling emotionally drained and irritable. If you're noticing significant changes in your emotional well-being, it's essential to consult with your doctor or a mental health professional. Let's continue exploring other signs that you should be aware of. We've already discussed darkened skin as a potential sign of prediabetes, but it's worth revisiting this important symptom. Acanthosis nigricans, characterized by velvety or rough patches of dark skin, typically appears in areas like the neck, armpits, groin, and elbows. This skin condition is often a visible manifestation of insulin resistance, a key feature of prediabetes. If you notice any unusual skin changes, it's crucial to consult with a dermatologist or your primary care physician for proper diagnosis and management. Let's move on to our final sign. While often considered harmless, skin tags, those small flesh-colored growths on the skin, can sometimes be associated with insulin resistance and prediabetes. Skin tags typically appear in areas where skin rubs together, such as the neck, armpits, groin, and eyelids. If you're concerned about skin tags, it's best to consult with a dermatologist. They can examine your skin, determine if any underlying medical conditions are contributing to their development, and discuss treatment options if desired. Let's move on to our final sign. Frequent yeast infections, especially in women, can be another sign of elevated blood sugar levels and prediabetes. Yeast thrives in warm, moist environments with an abundance of sugar. When blood sugar levels are high, it creates an ideal breeding ground for yeast, increasing the likelihood of infections. Yeast infections can occur in various parts of the body, including the vagina, mouth, skin folds, and nails. If you're experiencing recurring yeast infections, it's essential to consult with your doctor to determine the underlying cause and receive appropriate treatment. Managing your blood sugar levels through lifestyle modifications, medication if necessary, and maintaining good hygiene practices can help prevent future yeast infections. That's it for the 14 silent signs of prediabetes. If you notice any of these signs, it's crucial to consult with a healthcare professional as soon as possible. They can assess your risk factors, perform a simple blood test, and provide personalized guidance. Remember, prediabetes can be reversed with the right lifestyle changes. Stay informed, stay healthy. Don't forget to like, share, and subscribe for more health tips and information.